Hello, everybody. This is one more Meet the Author event. My name is João Pitta from University of Geneva, and today I'm really pleased to share this small talk with a dear friend and dear colleague, Dr. Jasmina Bijelic from University of Turku in Finland. She has been working for a while in dental material science, and we had the chance to collaborate and plan a research project together during one of our visits in Geneva as a guest research scholar. And today we would like to bring you and to share with you this research, the outcomes of our manuscript of a very timely topic, that is temporary implant restorations using titanium-based abutments, applying a full digital workflow. So Jasmina, please share with me and tell us how many times have you seen or have you heard from other colleagues that a temporary implant restoration just got debonded or discemented from a titanium base?
Well, thank you, João, for the nice introduction, and hello, everybody. First, I would like to use this opportunity to thank Team Geneva for accepting me to stay with you and for giving me the chance to learn many new things. And also, João, I'm very happy that our work was accepted in the International Journal of Prosthodontics. But going back to your question, yes, I have seen many times crowns with lost retention as emergency case in the emergency room, but also I have heard many times from my colleagues facing the same problem. And I could say that it seems that it is happening very often that temporary crown on implant is lost. And this is an unfortunate event, of course, for the patient and of course for the dentist too. And it increases the treatment session, increases the number of visits to the dentist, and increases the cost, maybe treatment for the patients. And I guess that many of us in dentists, in these cases, we are all thinking that is how or are there any ways to control the stability of the superstructure over the implant?
Exactly, and I totally agree with you, and I must tell you, this happens not only in Finland, but also here in Switzerland. We have the same issues. We have crowns that start moving on the tie base and lose retention after a while, and of course patients are not happy. But in fact, if we want to use a full digital workflow, we are kind of obliged to use these titanium-based abutments as implant abutments. So Jasmina, I think, share what do you think, how could we improve this problematic in order to reduce the risk of discementation?
Well, first of all, of course, we all have to remember that we have to follow the recommendations given by the factory. But in cases like this, and many of us would like to somehow influence and to control this retention on the crown. So I think that modifying the inner surface of the crown in some way will be the way to go, will be the one of the way of improving the bonding interface between the crown and the T-base. And actually, this was the aim of our study. We wanted to see how we can influence or how we can actually modify the cementation protocol in order to improve the bonding interface between the temporary crown and between the T base.
Exactly. So to give you a bit an idea of what we tested in our study, let me share just a few slides with you, and here you can directly see the groups that we tested in this study. So as you can see, of course, we had as well a control group that in the manuscript is the group number 5, and in this group we didn't apply the digital workflow, but we did it conventional, like the dental technician would do, applying the conventional workflow. that is by using a titanium temporary abutment, a tube, and then rebasing the crown directly on top of this abutment. Then we have 4 test groups, and you see in each of these groups we have a different surface treatment and also different materials. So in the group number 1, we just followed totally the manufacturer instructions by applying this bonding agent to connect with acrylic and then the resin cement. In the group number 2, we sandblast the crown first of all with 50 micra alumina particles, and then we apply the primer and then resin cement, like some of the labs that we work with are doing. And then in group 3, we just modified the manufacturer instructions by applying a surface treatment on the surface of the inner surface of the crown. And so we sandblast the inner surface with a coat-jet that are 30 micra alumina oxide particles coated with silica. And then we use the same materials as recommended by the fabricant here. In the group number 4, we also sandblast the inner surface of the crown, and then we used another primer and resin cement as we used in the group number 2. So after preparing the samples, in order to make it clinical relevant, we placed all the specimens in a chewing simulation, and we applied aging process of 120,000 cycles, that what would correspond to approximately 6 months of clinical aging. And of course, we are talking about temporary restorations. They are made to be in mouth for some months, 3 months to 3 to 6 months maximum. So this would be what we would expect to be the adequate time to investigate the outcomes of these restorations. And after aging, we looked in the microscope, all of the specimens. What we could see is that in some cases, mostly in the groups where we applied, where we used the titanium-based abutment, we had a movement between the crown and the abutment. And most of the cases, the crown could not be disseminated completely from the titanium base, but we saw this movement that might indicate the beginning of the bonding failure. So what you can see, this happens in all the specimens applying titanium bases, more in some groups, less, for example, in group number 3, but this didn't happen in a group, in the control group where we use the titanium tube as the conventional workflow. After this, we also tested the pull-out forces, and as you can see in the screen, the results, we had very good results, very high pull-out forces when we use the titanium tube, temporary abutment, and when we use the tie base, we have very low retention values, with one group that behaves a bit better than the other, that is the group number 3, where we modified the manufacturing instructions. So maybe Jasmina, I would ask you, what do you think about these results, and most important, how could you, what would be our or your recommendations to our colleagues, clinicians, and also dental technicians that are today here listening to us?
Well, I think that you presented very well in your slide, João, that still the best way to control the stability of the crown, temporary crown over the implant, is in dental laboratory in a conventional way by using the temporary tube. But if we want to use the digital workflow and we have to use the T-base, then we have to consider modifying the inner surface of the temporary crown in any way prior cementation. And based on the results of our study, it seems that the methacrylate-based modifying agent works well when the inner surface of the crown is previously sandblasted with coat-jet. So basically we can conclude that first we will have to sandblast the inner surface of the temporary crown with a 30 micron coat-jet sand, and then to apply the methacrylate-based liquid for 3 minutes, and then to proceed with the conventional cementation.
Thank you, Jasmina. I think you summarized really nicely our results. And I really hope that we could give you all a good insight of our manuscript. So have a good reading, and hope to see you all soon. Bye-bye.
Yes, thank you. Thank you everyone for watching this. And I hope it was clear, the conclusion was clear, and I hope that you all will enjoy the reading. Thank you.